Hey, Clay Cuts here. I'm a therapist and author of Beyond the Bottle. I work with men and women who struggle with a variety of issues, including substance use disorders. I wanted to take a minute and answer a question that I get asked a lot, and it has to do with the difference between rehab and detox. I use those terms in quotes. I see in blog posts and hear in conversations those terms used interchangeably, and it's not a huge deal, but I just wanted to take a minute and answer the question in this video because a fair number of people ask me about it. So rehab or rehabilitation is different than detox or detoxification. Let me start with detox. So if we're chronically using chemicals, our bodies become physiologically dependent upon them, and that's not a sort of a metaphor. Our bodies begin to change their chemistry in such a way that our bodies expect that the alcohol or the opiates or the cocaine or the whatever it is to be present in order to, quote, function normally, end quote. And so if we're using the chemicals for a long time, stopping suddenly can be very dangerous, particularly with alcohol. Alcohol can be deadly if we're using it chronically and then suddenly stop. People can die from acute withdrawal syndrome of alcohol. So that's when detoxification becomes important. Detoxification is actually a medical procedure, and the way it kind of works is you'll go into a medical setting. Sometimes it's done in an emergency room, sometimes it's in a specialized hospital, or sometimes the specialized wing of a hospital that's just for detox. And what they'll do is mostly treat the symptoms, and they'll monitor your blood pressure, and they'll give you some other medications that sort of mimic the effects of alcohol in this case, and give it to you in smaller and smaller doses. They call that titrating the dose down. And so that over 2 to 7 days, usually 3 or 4 days is kind of the sweet spot, your body gradually gets used to not having the alcohol on board. And what that's designed to do is get you through the acute phase of the withdrawal so that you don't have dangerous reactions to it. And now that's usually, in best case scenarios, hopefully followed by rehabilitation, which is treatment, which can last anywhere from 30 to sometimes 120 days, and sometimes longer. But a lot of programs are 30 to 60 days in that time frame. And there you're past the acute sort of physically dangerous part of quitting alcohol. But what you do there is you learn the social skills and the spiritual skills and the psychological skills, and you deal with sort of the underlying causes that are related to your drinking. And following that, usually folks go into some sort of maintenance program, AA or NA or other programs, and maybe work with a therapist or a counselor to sort of continue to bolster their recoveries. So that's the difference between rehab and detox. I hear those terms used interchangeably, and they are a little bit different. They're related, but they're not the same thing. So I hope that helped, and I hope that clears up the question that I do get from quite a few people. If you have any questions or comments, put them below. Love to get a conversation going and chat with the community about this. Also, if you would please subscribe to my channel and like the video if you thought it was good. And I'd love to get this sent out to more people, and so we could get a really good conversation going and help people get sober, because that's my goal. Thanks for stopping in.